Hi, and welcome to another episode of Sustainably Speaking, where we're joined by Dr. Lorenzo Gonzales, a street medicine physician and community health advocate. In addition to providing medical care for the unhoused and other vulnerable populations, Dr. Gonzales serves on the board for Latino Health Access in Santa Ana and is involved with Climate Resolve and Physicians for Social Responsibility. We're excited to hear his insights on how energy and community health intersect. Let's dive in.
Hello.
Hey, how are you?
Doing really good.
Good. Well, great to have the conversation with you today.
Oh, I'm so excited about having this conversation.
Awesome. Let's start off with just talking about a little bit about you and how you found your way to the climate action space.
Well, I think for me, it really was personal, right? I decided to go into medicine, and when I was in medicine, I realized that the environment was impacting people's health. At that point, I felt like I needed to learn a little bit more, and it's when I got a master's in urban planning, and it kind of all tied it together.
So let's talk specifically about fossil fuels. People know that the burning of fossil fuels causes climate change, right? But one of the things that we haven't really looked at a lot of what has been air pollution. Now, this is something that you're involved in.
Absolutely. So one of the areas that I worked in was Wilmington, California, which is just right next to a refinery and right next to a huge freeway, which is the 710 corridor. Right. This is where I saw it a lot firsthand. This is when I started to see in the emergency rooms where people were having asthma exacerbations, where COPD exacerbations. People came in with diseases called idiopathic pulmonary fibrosis. And looking at it now, idiopathic meant like we didn't know what it was caused by. But I think if we look deeper, if we see people living next to these huge industries, we can see a connection. There's a lot of inflammation from the particulate matter that's being used from the actual cars that are running through these areas. This is in our air, and when we inhale it, it is causing these short-term and long-term problems. You know, we see the short-terms from the nosebleeds, from the asthma exacerbations, but then the chronic issues. I think that's the part where people have a little difficulty in trying to connect the dots.
Right, and so is that why when we talk about disadvantaged communities that have historically not seen so much investment, but have seen some of these kind of heavily air polluting industries in their community, is that why we're saying that in these communities that they have higher levels of health impacts that are related to air pollution?
Well, we definitely see that these communities do have higher pollution. We see that areas around freeways have higher numbers. We see that there's higher levels of people going to the emergency room from these zip codes that we have. We cannot ignore what we're actually seeing in our clinics, in our emergency rooms. And then what we're really doing is providing care for something that we can probably look at making changes upstream. How do we avoid the pollution? How do we make sure that people have the air to breathe that they need to be able to live, love, and grow?
So you're active in several different organizations that are really making a difference in Orange County communities. Tell me a little bit more about some of these organizations.
The ones that I would say that really are pertinent to the conversation is Latino Health Access, which I started as a volunteer when I was 18, and now I'm a board member. The other one is Physicians for Social Responsibility, really bridging what a physician can do to make impact in these type of spheres. And Climate Resolve, a very innovative organization looking at how they can be leaders when it comes to climate justice. Those are the three organizations that I feel like in common, they have one thing, which is how do we make sure that folks that make our decisions, from the individual, the city council members, the supervisors, that they're being informed on the full scope, that there is a health impact. And that takes time, and that takes organizing individuals, and also takes resources. You're being asked to thrive, but a lot of folks are just focusing on surviving. Learning how things happen in a city and being able to advocate for organizations like OCPA. Being able to say, this is an organization that we want to bring into our space and be able to expand our choices when it comes to how do we use our financial power to bring in clean energy.
I was reading that you have a degree not only in medicine, but also in social and community planning. So tell me a little bit about that and how that is related and connected, because it sounds really interesting.
Joe, everybody thought I was crazy when I was like, I should venture off medicine and go into urban planning, social community more specifically. But it felt right. It felt like it was what I needed to discover in order to put all the blocks together. I was learning about people being sick, and I was seeing people being sick, and it just kept being not the same exact person, but the same area, the same zip codes, the same everything was coming into the emergency room. And I didn't understand what was that connection. So I decided to take some time and to learn more about how cities were built, how communities were built, what's that social fabric that brings us all together. And that's when you started to see a lot of what we see today in the emergency room or in our clinics are direct connections from things from our environment.
What are some of the things that some of these organizations, that you and some of these organizations are advocating for, and what is the future that you see?
I would say we had such a great win within the last 2 years. Part of the Physicians for Social Responsibility, which was a part of a larger coalition called Stand LA. We truly believe that there needs to be a future without fossil fuels, and they can't be oil drilling in areas what we call sensitive uses. This is where people live, this is where people go to school, these are churches, these are retirement homes.
Right.
These areas, they needed to be a policy change in order to have that. And this was actually almost a 10-year endeavor. We should be able to live, work, and play in the areas where we're at. And really envisioning this idea of like, what does transit-oriented development look like? What does it mean to be able to walk safely down your street? What does it mean to not have a heat island effect, which means it's just too hot to walk? Like, let's make sure that there's trees. And this all combined together in this idea is like, can we make sure that folks have access to an economic opportunity that is not 2-3 hours away? Can we make sure that people have their, what I call utilitarian exercise, right? Just being able to do physical exercise by means of just living. And then being able to be safe and being able to want to be outdoors, meaning you don't have your asthma exacerbations because you want to go exercise. This was the idea of complete streets. This is what they first brought into the city of Santa Ana as a wellness chapter. And that was a huge feat. Being able to say as a city that what we care about and put it in writing is health. I think that's the direction that a lot of communities should be going towards.
And this is one of the areas where Orange County Power Authority can be of help. So when we're talking about complete streets or sustainability or any other more EV charging, more electric bikes, or more various ways of getting around their city that are more sustainable, Orange County Power Authority is about investing in those options and those abilities of cities to kind of move toward that sustainable future.
The more that we are having this shift, the more it's going to be used, and then the individual can start making those decisions, right?
What can they do in their lives to make a difference in terms of the environment where they live and climate, the change in climate, which is causing environmental impacts like air pollution?
One of the things that I was really passionate about is trying to make sure that people understand that gas stoves are emitting pollutants inside our own homes. And although some of us will not be able to exchange our gas stoves, for those folks who have the ability.
Like pricing has come way down, and some of these electric stoves are really, very efficient and not as costly as some of the gas stoves, and are really good as well. And actually, Orange County Power Authority has some programs to incentivize it as well.
And I think that's where a lot of partnership can really happen, is people are rightfully so busy. And therefore, the easiest way to provide this information to be like, these things are available for you, and they can make small changes that can impact your life is incredibly huge. And then once you start looking outside the door, right? Once you start looking at, well, what do I do on an everyday basis, and how can we tweak those things? If we can all move a little bit by little, I think the needle moves a lot larger as a collective.
Well, thank you for this conversation today. I mean, I learned a lot. And so, and I'm very appreciative of everything that you're doing in our communities here in Orange County and in Los Angeles as well. Thank you for joining us. We hope you've learned more about climate change and its impact on public health, and how organizations like OCPA are creating solutions for a cleaner environment. Sharing knowledge and ideas is how we can empower each other to take meaningful action in addressing climate change. That's the power of community. See you next time.